headquarters of common sense.
Talk Radio.
Jackie, firstly, is this decision brave or stupid?
I'm afraid it's deeply stupid, What was notable yesterday was the absence of Chris Whitty, Patrick Vallance, any scientific data whatsoever. And it looked remarkably like a move to distract from the Prime Minister's problems, just thrown out at the beginning of Prime Minister's questions. What you have to think is 276 people died of COVID yesterday. That's the equivalent of a commercial plane crash in this country. And that's been the case since the beginning of the pandemic. And extraordinarily, that is now the new normal in this country.
Died with COVID, fair to say, Sarah, right?
Sorry?
Died with COVID as distinct from... Jackie, died with as opposed to of COVID. Is that fair?
Died with it on the death certificate. It's true, and of course, there's lies, damn lies, and statistics.
Yes, heads.
That's a difficult one to sort out. But we know that people are still dying of COVID in high numbers and occupying hospital beds in high numbers. We know that there are, I just had an email from a colleague this morning saying we're still on the highest operational alert. We've got 10 ambulances queuing outside the hospital. Patients are having dreadful experiences. And that's not even to look at new variants coming out. There's all sorts of reasons why this was absolutely the wrong decision. And the tone that he did it in made people think the pandemic's over, and it really, really isn't.
Henry Smith, Conservative MP for Crawley. The pandemic isn't over. Is it a brave decision for Mr Johnson or a stupid one?
Well, I think it's a brave decision if those are the two choices that you are giving us to choose from.
You can have another if you like. We're a democracy here, Henry.
Well, I think it is the right decision now that COVID has become endemic in our populations, as indeed it has around the world. We can't live under pandemic restrictions really for very much longer, and we have just heard about the impact that has on other health conditions, such as the cancer backlog, which has been made much worse, the impact that restrictions have on things like mental health. And then that's not even, of course, talking about the economic impact. So I think, learning to live with COVID as the variants appear, as they mutate to become, yes, perhaps more virulent, but less deadly and creating serious illness overall, it is about the right time for us to move to a much greater sense of normality. But that doesn't mean that we shouldn't be cautious. And I think the Prime Minister very clearly stated that, of course, all of this is kept under review. I still wear my mask on public transport. We've had a world-leading vaccination programme. I think that's helped as well. So I do think this is probably the right time of the evolution of this pandemic.
Is that fair, Jackie? As Henry is alluding to there, the numbers are very much down. We haven't got overrun hospitals with COVID. There are still issues in some areas, of course. The amount of people dying is no different statistically to any other year based on a 5-year norm. And it's endemic now. So that's a change to where we were a year ago.
I think this manipulation of statistics, for a start, is deeply worrying. I think we have to accept that 276 people died yesterday and have died every day since the pandemic started with COVID on their death certificate. And the argument about getting on with other people who haven't got COVID is a very interesting one, because of the hospital beds still have a large number of COVID patients in them. 80% of the population have had a first vaccine, 70% have had a second, and only 50-something have had their boosters. So people are still getting COVID and dying with it. So if we want to tackle that 6 million backlog, we are going to have to start emptying hospital beds.
How many people are dying with Omicron?
That's what are these? Who are the 276 deaths from yesterday? I think that was mostly Omicron. But I just want to move away just a little bit from those statistics, which we can all, sort of push around endlessly, and just talk about vulnerable people in this country, because there are something like 4 million people who are extremely clinically vulnerable in this country. Either they can't have the vaccination, or their immune systems are weak and don't respond to it, and they will now be very frightened, because there was no plan announced yesterday for those 4 million people, nothing. And I know some of them, you all know some of them, and they're of all age ranges and not necessarily the elderly. And they don't know what to do now. Can they see their families who are going to be out and about, or they're going to have to go back to where they were for 2 years and just stay at home? And I think it was completely reprehensible that the Prime Minister stood up yesterday and said nothing about that large proportion of people in the population. We're really moving towards herd immunity, which is what Johnson wanted in the first place, of course.
But isn't that surely where everybody should ideally want to be? Any country.
Henry Smith quite rightly talked about, I'm going to continue wearing a mask. I'm going to continue wearing a mask. You might continue. But people now feel, the people who were always chafed at those things will feel we don't have to do this anymore. And those courtesies to other people will be dropped. I mean, I live in London. I travel on London transport. There are a lot of people now who don't bother with that small courtesy. And they will feel that's the end of this now. And it does come back to, what do those vulnerable people get? They can't move around.
Let me put that to you, Henry. I mean, that's a fair point, isn't it? That the vulnerable people, that particular group that could very easily, because of their vulnerabilities, contract COVID, even if it is a slightly lighter variant, if that's the way to look at it. But to a vulnerable person, that could be pretty dangerous.
Well, look, I think we have to recognise the fact that COVID will be with us probably for the rest of all of our lives. It will be in the community globally. Therefore, it begs the question, when do you lighten up on restrictions? Are we really to be mask wearing for the rest of our lives whenever we're out and about and keeping a distance of 2 meters and other things? I think, good hygiene and being sensible is, of course, important, generally speaking, anyway. We have excess deaths, sadly, at this time of year in normal times from influenza. I'm afraid there are viruses that will sadly create serious illness in some people and kill some people. We are all going to die of something. And on the point of the immunosuppressed and immunocompromised, I chair the all-party parliamentary group on blood cancer, and this is an issue I've been raising principally with the Health Secretary. There are plans in place to particularly offer protection to those in those vulnerable categories, difficult though that is. But we do have to have the discussion, do we completely change the whole of our society and economy because of a virus that will be with us forever?
And that, Jackie, is, that's question, that point can't have eluded your thinking. If this is with us forever, do we have restrictions forever? We don't have restrictions for flu and other viruses. Why would we with this one?
I don't think we're presenting two ends of the spectrum here. I don't think it's necessary to live as we have under lockdown while we did, which was entirely necessary because we know now that the economic outcome is tied very much to the fate of the population. So the countries who locked down and protected their population have done the best economically because they have gone back the fastest. So don't let's ignore that. But what worries me is that we didn't hear from any scientist yesterday. We didn't hear the scientific data. We've now got scientists coming out saying, well, exactly as you said at the beginning, is this brave or stupid? And their opinion is generally, this is stupid, it's too early. Nobody's saying we have to do this forever. But what they're saying is a little bit longer and we'll get there. We've still got these rather poor, despite the government's, boasting about the vaccination. We still had half the country haven't had a booster against Omicron. A quarter of the country haven't had their second dose yet. So it's about getting that up to scratch. And masks, I'm a doctor. I've worn a mask all day. It's not a big deal. We're not saying we're going to do it for the rest of our lives. We're just saying protect those vulnerable people that Henry Smith recognises. I mean, he clearly cares about them. He's on that committee. And 4 million vulnerable people, that's not a small number of people. That's a lot of people now challenged with this huge thing. So just a little bit longer, get vaccinated, put masks on, be sensible, but don't do this dead cat on the table thing yesterday, which was so shocking. All
right, Jackie, thank you. Dr Jacky Davis, consultant radiologist, and Henry Smith, Conservative MP for Crawley, with us here on Talk.
Good talk. Hot talk. Bold talk. Talk Radio. Listen on your smart speaker.
Watch it live on your smart TV. The world headquarters of common sense.
Talk Radio.